So what can the patients do to help prevent blood clots?
I think there's a few things. Number one, I think when they see their cancer specialist, they should ask, what are my risks of developing a blood clot? I think they need to make their healthcare professionals aware. There are some cancers now that the guidelines would recommend you have a prevention medicine, a prophylactic medicine during chemotherapy because the risk of getting clots is so high. We know that patients with myeloma who are receiving certain chemotherapies, it is routine practice to give them thromboprophylaxis. That means prophylaxis prevention against clots. Pancreatic cancers as well, the guidelines recommend prophylaxis. There's also been some studies recently which have looked at patients who statistically are at a higher risk of developing clots by using a risk assessment tool called the Karana score, named after Dr. or Professor Alok Karana, who developed it. And that will show which people are most at risk of getting blood clots according to certain measures like the type of cancer, the certain blood results, their weight. And that may identify who is at additional risk and may be considered for prophylaxis. So number one, patients, I believe, should never be afraid to ask their doctor whether they are at greater risk and should they be having prophylaxis. Number two, I think wherever they can, keep hydrated so that the blood is less likely to become sticky. Number three, try and be mobile. And if you're not able to be mobile, at least move your legs around. Just having your feet, doing that with your feet, will increase flow up the leg. So just doing that, wiggling your feet around will make a difference. And then finally, be aware of the symptoms which are suggestive of blood clots and seek help sooner rather than later. Now, when I was first doing research into this field, your average cancer-associated thrombosis patient, when they'd had a blood clot, I was seeing people, most of my patients wouldn't live a year. So we didn't even look at long-term complications of blood clots because you never lived long enough to get them. We are now seeing people living with metastatic cancer for years and years. Certain cancers like breast cancer has almost become a chronic disease because doctors are so good at keeping people, they're so good at keeping people well with that cancer. So we're now seeing people with cancer who, when they originally had a clot, because it wasn't treated soon, they've now gone on to develop long-term complications. One such complication is postthrombotic syndrome. That's when the blood clot has caused damage to the valves in the leg, and those valves are normally there to stop blood coming down the legs again and swelling. But if those valves get broken, blood continues to pool in the legs, and these people may get chronic swelling, they may get chronic pain, they may even get ulcerations of the legs. And that is a lifetime diagnosis. So therefore, it's not only important to get the clots diagnosed and treated early as possible, because you don't want to have a large clot causing problems, it's also thinking about the future and making sure you don't have the complications of a clot long term.